We're on the Health and Human Services issues. Let's go down that road a little further. A viewer from Willmar indicated that years ago the state started closing regional treatment centers, and now it's going after closing group homes. Is the state getting out of the mental health care business? Mental health care, anybody want to talk about that? Anybody know anything about the status of the session?
Well, in Willmar is especially sensitive because there's the polls out there now to close the CABS program. That's for the adolescents, and those that really need a pretty serious care. It's actually a hospital setting. And the concern is that we don't leave a gap in coverage there. And we've got the proposal backed off for another 6 months now to give more time to work on it. They want to replace the CABS program, and I always forget these acronyms, but it's the next level of treatment that isn't quite a hospital setting. And the CABS program, they want to relocate that, partly because the building in Willmar isn't set up structurally correct for that type of treatment, so they want to move that, I believe, closer to the metro area, but then replace in Willmar and around the state a program that's not quite that level of care and where there's actually more demand, and increase the services in that area. And I think that's actually a good plan, just so we don't leave a gap there of coverage while they're making the transition, and that's my biggest concern. For Willmar and Kendall County itself, of course, there's a concern, too, about the people who have jobs there. And, of course, you know, we're worried about their jobs and their families. But it's a bigger issue than that. We have this workforce with this pool that has this training and these skills in this area, and we don't want to lose them, have them leave the area. And that's another reason why we'd want to make sure that there's something to replace any of these closures before they actually happen.
Any thoughts on this from anyone else?
You know, the Republican, I hate to pick on them, but the Republican budget in the House is cutting more than $1.1 billion from the Health and Human Services budget. And that's cuts of the ones that affect the most vulnerable Minnesotans. And got to...
That can be looked at a couple of different ways, Representative, and I agree that the mental health area is one area that our schools are needing more people in the field. It's an area that we don't have enough people, psychologists, psychiatrists, to work and help people, but I agree that it's an area that
and the worst thing we do is turn our jails into mental health systems. The number of people in jail who are really suffering from a mental health issue is very serious.
And that's another issue that's being talked about around the state and in Willmar, which I'm familiar with, of course, is that the law enforcement and the court system is getting too many people in the judicial system that really need treatment, and so we need to work on that, I think, too. What happens is that they get a patient will do something that's kind of out of control of the staff that's there, and so then they call law enforcement for help, and law enforcement doesn't know what to do with them, and if they damage some property, then of course they bring them in and there's file a charge. And
right, and so then now they're in the criminal justice system.
Exactly. Instead of getting treatment is what they really need. So that's an area that we really need to work on.
But spending in the House plan is going to go up by $400 million. Again, you can look at it a couple of different ways, but in actual spending, it will be going up under our plan.
Well, I think some of the other issues that are out there too, and I think this issue as it relates to the justice system and mental health system, where do they go and where do they wind up, is a real problem. But we're also seeing things like some of our treatment centers, and I know we have one in my district for alcohol and drug treatment, and quite frankly. The payment structure, there's been an allowance that the insurance is paying less, and they're getting a couple $100,000 a year less, and that's about what they're losing a year, and so there is a very real risk of some of these services disappearing.